upper limb, pelvic bones, everything. Okay. So I hope you understood the upper limb and lower limb bones and other bones which are given and named in this images. So basically you have to you have to draw the diagram of these bones, then only you will able to understood very easily. Okay, so kindly do everyone. So today we are going to start the topic about joints and articulations. Joints means connection of two bones. Okay, so mean meeting of two bones. Okay, so basically what happened, our nature divided the bones. If what happened that if one single bone is given in the upper limb, if things this is the hand, if this is the leg, what will happen? You have to walk very straightly. You will only lift your hand with straightly. You will not able to move like this. Okay. So everything you will depend upon doing some extra work. Okay. You will not able to help yourself easily. So that's the reason nature gives joints, okay, to move easily, to give you mobility, flexibility, and whatever you have to want to do within your limits, you will able to do your own works. Like if you want to see who is coming in your backside, you will able to turn your head. Okay, this is the limitation. Okay, and your work is also going. Okay, you're able to understood what is happening backside of the your body. Okay, so basically the points of joints in our body is mobility and whatever daily needs you have to do, you will able to do. Okay, so basically the joints are divided into different categories. Okay, let's talk about the classification of the joints. The classification of joints is based on the amount of movement possible. So how the joints are divided depend upon the movement. If I am moving this elbow joint front and backward, so what is the type of this joint? If I am rotating this shoulder, so what is this? This is able to rotate four sides, right, left, up, down, and you will able to rotate. So what does it means? It means that in our body we have different types of joints. Okay, according to their work, okay, according to their movement. Okay, nature gave us the different types of joints. Okay, so here we have suture joint between two cranial bones. In the starting, we talked about our skull. We have parietal bones. What do we have? We have parietal bones. So parietal bones join together. So the joints is named as suture joint. Okay, and amphiarthrosis is a slightly movable joint, such as symphysis joint between adjacent vertebrae. And the second type of joint is amphiarthrosis. It is mostly in the vertebral column. Okay, one vertebrae, second vertebrae is slightly movable. Okay, this is the largest category of joints and included the ball and socket joint. So what are the types of joint we have? Ball and socket joint. Okay, ball and socket joint, the pivot joint, the hinge joint, and others. Examples of each types of joint are described in 6.5 in 6.15. Okay, so here we have the diagram. What types of joints are there? Categories, descriptions, and types and examples. So let's talk about the first joint, which is called synovial joint. So basically, here the main details are not given. Okay, in this table only they gave that. So let's talk about the joints. Sino-arthrosis joint. Sino-arthrosis means immovable. So there are number of joints in our body which can't able to move, but they are still joints. Like our skull. Skull have joints. Joints mean two bones are coming together and they are attached to each other. Okay. So that's the reason we called as joint. Okay. In the forehead, we have immovable joints. Okay. Those named as synostosis joint. Okay, synostosis joint. Next is what type suture joints. Okay, suture joint. Fibrous connective tissue between bone surface. So this is made up of fibrous, tough fibers connective tissue between two surface. So between cranial bones, between facial bones. Let's see the image. Okay, can able to everyone.
Sir, I rejoined.
So so here we have three types of joint: synostosis, amphiarthritis, and diarthritis. Let's see the synostosis. Synostosis can't able to move. Here we have the it is always fixed. It is always fixed. Okay. So why this is happened? Because whenever you are able you fall, head injury occurs. Okay, traumatic head injury. Okay, road accident, road traffic accident, whatever it happened, whenever you fell down. So these things will protect your brain. Okay, there's the reason here the fixed joints are given, which are not even movable. And even our face have immovable joints. Okay, this is the example of synostosis joints. Next, we have amphiarthrosis joints, which are slightly movable, like symphysis, disc of fibrous connective tissue between bones, vertebral column, pubic bones. Let's see that image. You can see that vertebral column. Okay, these are the synorthrosis. Sorry, amphiarthrosis. Okay, amphiorthosis, which are slightly movable. Here that you can see the image. Yeah. And the pelvic bone also, pelvic bone. This is also slightly movable. Okay, slightly movable joint. Okay, so we talked about synorthrosis and amphiarthrosis. Now we will talk about diarthrosis. Diarthrosis is a freely movable joint. So in that we have different types of joints: ball and socket joint, hinge joint, condyloid joint, pivot joint, gliding joint, sladle joint. Okay, so we'll see the everything here. Okay, ball and socket joint will move in all directions. Will move in all directions. Like example, scapula, scapula, humerus, pelvic bone, and femur. Femur. Okay, so these are the example of ball and socket joints. Let's see in the image. So ball and socket joints will move in all direction. Okay. So this is the femur bone. You can see here. This is the shoulder bone. Okay. Okay. So these are the ball and socket joint examples. Okay. Because of this ball is fixed in this articular cartilage. Okay. So it will move all direction. Like the ball, you will spin any direction. Okay. So there's the shoulder joint and hip joint. Next of all, hinge joint. Hinge joint only have one direction. It may be front or back, like humerus and ulna. Connection of the humerus and the ulna. Femur and the sorry, tibia and the femur. Tibia and the femur. Knee joint, elbow joint. And we have phalanges. And we have here we have the wrist joint. Wrist joint. Okay, wrist joint. Wrist joint also only one direction. Maybe forward or backward. Okay. And we have elbow joint. We have knee joint. Okay, let's see the image of hinge joints. This is here. We have the hinge joint. Hinge joint like this, like a book. We have the book, you can open it and the close it. Okay, this is the one side. Okay, like hinge joint, we have uh elbow joint. This is knee joint. Okay, these are the hinge joints. Next we talked about ball and socket joint, hinge joints. Next we have condyloid joints. Condyloid joint movement in one plane with some lateral movement. Movement in one plane with some lateral movement, like temporal bone and mandible. Like our mouth, we'll able to open our mouth and we will eat food. Okay. So this joint is known as condyloid joint. Let's see the image of condyloid joint. Condyloid joint. So where is the condyloid joint? Mandible. So see here we have the mandible. This is the mandible, maxilla and mandible. Okay, so you'll able to open. Ah, ah. Okay, so this is the joint. Next we have pivot joint. Pivot is rotation. Atlas, axis, radius, and Allah. Okay, like this is the first cervical bone, that is atlas. Second axis is fixed into the atlas and it will rotate. That's the reason we will rotation, four sides, rotation, right and left, no backward. This is called pivot joint. Pivot joint. Okay, pivot joint. Let's see the image of the pivot joint. This is the pivot joint. This is the cervical number one, cervical number two, right and left. Okay. Next we have gliding, side to side movement. Side to side movement. This is the carpal bones. These are the carpal bones, metacarpals, phalanges, tarsals, metatarsals, and phalanges. Okay. Let's see the carpal bones image. Gliding joints. These are the gliding joints. See, wrist bones. Okay. Wrist joint is other, but carpal bones, these have the some movement. These are the forward and but you can rotate that with the help of gliding joint. What is next? Next is saddle joint. Movement in several planes, carpo, metacarpal, thumb. Thumb have several joints. You can move forward, backward, okay, sidewise. You can rotate the thumb. So this is the saddle joint. So these are the different types of joints which are present. Synorthosis, amphiorthosis, diorthosis. So these are the three types of joints we have. One is fixed, one is slightly movable, one is freely movable. In the freely movable, we have different types of joints: ball and socket joint, hinge joint, condyloid joint, pivot joint, gliding joint, saddle joint, etc. etc. Okay. So this is all about the topic called joints. Now we will talk about synovial joint. Very, very important thing. Kindly wait for 1 minute. So next we have the synovial joints. All diarthritis are freely movable. Okay, freely, whatever the freely movable joints are filled with synovial joint. Very, very important. Synovial joint. We will talk about synovial joint in detail. Synovial joint. Okay, because this is very important topic. Synovial joint, because they are similarities of structure. This type of typical synovial joint is shown in figure 6.16 on the joint surface of each other. हेलो हेलो बोल बोलिए कॉल आया था. So basically whatever the free movable joints which have we have synovial fluid, they have the synovial fluid which makes them move freely. Okay, so basically that's the reason they are named as synovial joint. So which joint have synovial fluid, so that's the reason we call them as synovial joint. Okay, so let's see that. In that we have articular cartilage which will produce smooth surface. So basically this is the bone. In the bone above we have articular surface. Every bone, whatever the bone have synovial fluid, we have articular surface. Both bones. Okay, at first is articular surface. The joint capsules of fibrous connective tissue. So these are the five made up of fibrous connective tissue, includes the joint in a strong sheath like a sleeve, lining the joint capsule in the synovial membrane. So other than they have synovial joint, synovial membrane. They have the synovial membrane. We'll see in the image also. Okay, synovial membrane, which secretes synovial fluid. So this membrane will secretes synovial fluid. Okay, into the joint cavity. Synovial fluid is thick and slippery and prevents friction as the bone moves. So why we need synovial fluid? It is thick like a paste. Okay, like a jelly. Okay, it will make them sleepiness. If you want to move easily, you can able to move like grease. Okay, and it will able to protect the bones from the friction, from the rigidity. Okay, so basically let's see in the image. Here we have the one example. It is example of joint, synovial joint. It is known as knee joint. Okay, this is the bone, this is the bone. In the bone we have, here we have this is the joint capsule. Okay, this is the articular cartilage. Told you that it is articular cartilage. Okay, this is the synovial membrane. Okay, this is the synovial membrane. So this is this synovial, you have synovial fluid here which will release in this area, also in this release there are also. Okay, and this is the bone. Okay, these are the things which are available in this area. And as well as we have bulsa. We have many types of anterior, posterior, medial bulsa. What their work? Let's talk about that. Many synovial joints have bursa, which are small sac of synovial fluid between the joint and the tendon that cross over the joint. Bursa permit the tendons to slide easily as the bones are moved. If a joint is used excessively, the bursa may become inflamed and painful. This condition is called bursitis. Some other disorders of joints are described in the arthritis. So basically, what the use of bursa? This is the bursa. In this is a sac-like structure. Means it is the one packet is there. It is filled with synovial joint, synovial fluid. Okay, what happened that this fluid, whenever your tendon, we have tendons, now these tendons are attached from anteriorly, uh, frontally, backly, posterior, everything. We have a tendons which connect that two bones. Okay, so we will rotate easily with this area which have membrane, but we need tendons also this fluid to move more easily. So there's the reason. So nature put the synovial fluid for tendons also. Okay. So there's the reason we have bursa here. Okay. Whenever excessive use of your joints or any injury will call bursitis. So whenever the patient complains about knee joint, please check all these things. You have to check the bone, you have to check the articular cartilage, you have to check the synovial fluid. If the synovial is less, you will able to hear the sound of friction. Okay, joint fluid cavity, tendon, everything is there in this knee joint. So you have to examine everything whenever the patient complains about knee joint pain. First ask them, is there any injury? You fell down or not? He told, no, sir. No, ma'am. Then you have to check this. If this is example, this is the knee joint. You have to ask them, please knee move freely. If you are able to hear the crick crick sounds, then there is the loss of or decrease of synovial fluid. Second thing you have to ask, you have to check down which area you have the knee, you have the pain. If you have the pain directly, it is involved in this area. You can told them that this is known as synovial joint fluid decrease. Here the synovial font is decreased. That's the reason you have the pain. Or else you have to check this area, this area, this area, this area, frontally, backly. Okay, then if it is bursitis, you have to treat the bursitis. Okay, so this is all about synovial joint. Next, we have the topic called aging and the skeletal system. With age, bone tissue tends to lose more calcium than is replaced. So whatever happened, whenever you are getting old, the calcium is lost. So we are taking 100 mg, but our body utilize only 80 mg. So we have remaining 20 mg is not getting, then only the bone matrix is become thinner or brittle. Fractures are mostly happening in this area. So falling down, mild injury can cause fracture. Erosion of the articular cartilage of joints is also a common consequence of aging. Joint effect included weight-bearing joints such as knee, active joints such as those of the fingers. So whoever have more weight, okay, they have also knee joint pain. Okay, uh, upper limb pain, wrist pain, shoulder pain because of their heavy bearing joints. Okay, next. So here we have one topic called arthritis. So let's talk about arthritis. Arthritis means arth means joints. Itis means inflammation. Inflammation of the joint. We have very different types of arthritis. One is osteoarthritis, and second one is rheumatoid arthritis. Osteoarthritis is natural consequence of getting older. In joints that have some weight for many years, the articular cartilage is gradually worn away. The worst smooth joint surface become rough and the affected joint is stiff and painful. As you might guess, the large weight-bearing joints are most often subjected to the form of arthritis. If we live long enough, most of us can expect some osteoarthritis.